So, Mary, what would you say are the main health problems in the village?
Okay, one of the most important things which I've discovered in the villages is malaria. Malaria has killed so many children and many big adults because there is no way they can access the treatment very fast. Yet malaria can easily be treated. They have a problem of far places, like if they want to go to the health unit is very far from where they are staying. And sometimes when they reach the health unit, you find the place is closed. There is no health worker working. And sometimes you find there is a problem in the health unit. There is no medicine in the health unit. When you get the health worker, he can tell you there is no medicine for treatment. So the villagers really have a big problem in the malaria treatment.
Yeah.
Yeah.
And with your malnutrition work, what are you doing at the moment with malnutrition work, and what would you like to do? What extras would you like to do?
Okay, like in the malnutrition work, we really had a plan to train more volunteers who can help us reach different places in the villages, because they used to stay in the camp. It was easier for us to move around within the camp. But now people have gone to different places and deep in the villages. So we want to get people who stay in the village and train them to use the mark tape so that they can identify the children and refer to the feeding centers. And most of the malnutrition cases, most of them, they are HIV positive. So we try our best to refer them to the main hospital where they can get some help and some treatment. But most of them, especially the children, they end up dying because you find maybe they have malaria, they have malnutrition, they have diarrhea at the same time. So by the time we reach them, you find that the condition is really worse, and you find the child cannot be helped anymore and the child dies. In fact, you find that such a child has malaria, and malaria dehydrates, and the diarrhea also is there. So the condition worsens and the child just dies. Yeah, but if we had some services which are nearer to the parents in the village, like some medical treatment which is easily monitored, given to the child, like some malaria treatment, if the children are if they are sick, they can be prevented. And the feeding can also continue as we keep on teaching the community how to prevent malaria and how to treat some diseases like diarrhea, because we give them some health education on how to prevent diarrhea, how to keep their sanitation clean so that they reduce those risk of diarrhea on their kids.
That's great.
Yeah.
Thank you, Mary.
Yeah.
That will be really helpful. Finished.